What is an anteverted or a retroverted uterus? And there's a secret other language that we use to describe where the position of the womb is in your body. Simply put, anteverted, so the cervix, which is the lower part of the uterus, so this is the body of the uterus, that sits forward towards where the bladder and the abdomen is. And if I show you on this model, if I show you this bit, this is the cervix at the bottom, because this is the uterus that is sitting towards the front, towards the bladder. And therefore the opposite, the retroverted uterus, so the body of the uterus is bent backwards away from the bladder and towards the rectum, so it goes backwards. And a retroverted uterus is the opposite of that. So the body of the uterus is bent backwards towards the rectum, which sits at the back. So if you're looking at the cervix, then this cervix is going towards the back, towards the rectum, and that's why it can sometimes be a slight struggle to find it. And then there's the third type, which not many people know about. It's called the anteverted retroflex. So this is a combination between where the cervix is tilted forward towards the body and the bladder, but the body of the uterus is bent backwards towards the rectum, which is towards the back. So therefore, it can be a bit sort of difficult to find, particularly if you want to do an examination. So if you look on this, so the cervix might be towards the sort of forward, towards the bladder, but actually the uterus is bent backwards towards the rectum, and therefore the positioning might be slightly tricky. The most important thing to know is whether you're anteverted or retroverted or anteverted retroflexed, whatever position that your cervix is in, it is not a medical condition. I sometimes say to my patients, having an anteverted or a retroverted uterus is just being like left-handed or right-handed. We know 80% of the population are right-handed, and therefore the cervix, we know 80% of the time when we see women, their cervix will be anteverted, so sitting towards the front. But there are those that are retroverted towards the back. It is not a medical condition. It's just us positioning your uterus depending on where it is in the pelvis. But I hope that helps. If there's any questions, leave them down below and I'll answer as many as possible.